Hi everyone, my name is Alisa and I'm going to be doing a question for the USMLE Step 2 CK. So I want you to pause this and read the question and see if you can answer it by yourself before I get into it. But if not, here we go. A 67-year-old man is scheduled to undergo an open sigmoidectomy for complicated diverticulitis in 2 weeks. He had a myocardial infarction at the age of 57, so 10 years ago. He has a history of unstable angina, hyperlipidemia, hypertension, severe osteoarthritis of the spine that limits his daily mobility. He quit smoking 10 years ago and does not consume alcohol. Current medications are aspirin, metoprolol, lisinopril, rosuvastatin, and ibuprofen as needed. His temperature is 36.4 Celsius, pulse is 88, blood pressure 139/86. Physical exam is normal. His EKG shows Q waves and inverted T waves in leads 2, 3, and AVF. His BNP is within normal limits. So which of the following is the most important next step in order to assess if this patient is ready for surgery and assess his perioperative cardiac risk? So let's start at the top. So we know that this patient is 67 years old. He has a surgery in 2 weeks. What is the surgery? That'll be important for later. So he has an open sigmoidectomy. That's high yield fact number one. So he also had an MI 10 years ago. That's important thing number two. He also has a history of unstable angina, hyperlipidemia, hypertension, but unstable angina is ischemic heart disease. So that's high yield fact number three. His vitals are within normal limits. Physical exam is normal. EKG basically tells us that he has evidence of a previous myocardial infarction, likely in the right coronary artery. So what do we know from the question stem? We know that he would likely need some sort of testing, right? Intuitively, you know that he needs testing. However, did you know that there's actually guidelines for who needs testing? So guidelines are called the Revised Cardiac Risk Index, or RCRI. And there's really 3 reasons that for surgery you might need this index. The first reason is the procedure. So I remember I said he's getting open sigmoidectomy. And why does that matter? That's because if you're undergoing any intra-abdominal surgery or suprainguinal vascular surgery or intrathoracic surgery, you will need a revised cardiac risk index. There's also 5 patient-related factors. So if a patient has any of these, they're getting one of them. So that's ischemic heart disease, which we said he has unstable angina, so he's already a candidate. Congestive heart failure, history of stroke or TIA, creatinine over 2, and then insulin-dependent diabetes. The third reason you might get this test is if you have poor functional capacity. So if you have chest pain after climbing a flight of stairs or walking on level ground at 4 kilometers per hour, or performing any heavy work around the house and you get chest pain, you automatically qualify for one of these tests. We already know he's getting an open procedure and he had an MI and has unstable angina. Perfect, he qualifies. There's something else that we need to know, and that's the fact that he has very severe osteoarthritis of the spine. So he can't move. That's pretty severe, and it limits his exercise capacity. He also has unstable angina. Well, we know that isn't affected by exercise, but it might influence how much he can handle. But more importantly, he can't really move because of his spine. So let's look at our answer choices. We have answer number 1, 24-hour EKG ambulatory monitoring. So the exams love to throw this out, but really, if this patient isn't presenting with syncope or any palpitations, you don't really need to monitor his EKG 24 hours. You can get, for this patient specifically, they already got an EKG and it showed them everything they needed to know. He has no complaints of, palpitation, syncope, anything like that. And this really wouldn't tell us anything about his perioperative cardiac risk. So we can pretty much cross out. The next option is a resting echo. Okay, so what does a resting echo tell us? It tells us, what is the status of your heart right now in this moment. It doesn't tell us about what happens if you get stressed out, what happens if you have to exercise, what happens if, your blood pressure changes. Resting echoes are great for patients with symptoms of dyspnea, chest pain, and syncope, none of which this patient has. So let's not rule it out just yet in case there's a better option. But generally, this is likely not going to be an answer. The third answer is exercise echocardiography. So this actually would give us a lot of information about his cardiac output during stress. So during surgery, we want to know how well his heart's going to do if something bad happens. So this would be a great option. However, he can't exercise. So he can't do an exercise cardiography, which means he actually can't do a treadmill stress test. So neither of these, right? So we're at radionucleotide myocardial perfusion imaging. That is a really long way of saying nuclear medicine testing with things like adenosine or dipyramidal for patients who can't exercise. So this is exactly what we need. This patient can't exercise. They're going to put him on a table and they're going to chemically induce his heart to work hard. And they're going to see which areas can't handle it. How does, are there areas of ischemia that they need to worry about? How much pressure can his heart withstand? And is it enough for him to undergo surgery? You know now that the answer is not resting echo, and the answer is definitely not no further testing, because we know this patient has quite the cardiac history and he's going in for an open procedure. So another thing, you could do instead of radionucleotide myocardial perfusion imaging would have been any kind of pharmacological stress test with imaging. So, the resting echo, the treadmill stress test with EKG, all of these things could have worked. However, the only one, the key point here is that the only one that works for people who can't exercise, whether it's for, arthritic reasons or because they have angina, would be the pharmacological testing with the nuclear imaging. So that's it.